Gentlemen, today we need to have a very honest, very private medical conversation. If you are an older adult and you masturbate, I need to ask you something that you have probably only ever asked yourself in complete silence. Have you ever wondered if it is still healthy for your body after the age of 50, 60, or 70? Or have you worried quietly, am I damaging my hormones? Could I be ruining my prostate? Is this somehow weakening me as a man? If you have ever had those thoughts, I want you to know right now, you are not alone. This is one of the most common yet least talked about concerns I hear in my clinic, and it is almost always asked in a whisper. For decades, older men have been left completely in the dark, surrounded by locker room myths, outdated cultural guilt, and a total absence of honest medical guidance. You have been told that self-pleasure drains your energy, disrupts your hormones, and weakens you as a man. But what does modern clinical science actually say? When you strip away the shame and the noise, the biological truth paints a remarkably reassuring and genuinely empowering picture. This is not a guilty habit reserved only for your youth. Modern medicine shows it can be one of the most protective and therapeutic practices for your aging body. But like any medical tool, it depends entirely on how you use it. Done recklessly, it carries real clinical dangers. I'm Dr. Lila Romano, a urologist with over a decade of clinical experience, and today I am going to walk you through both sides completely: the 10 surprising medical benefits science has confirmed, and the 10 hidden risks you absolutely must understand. Stay with me until the end, because I'm also going to give you something no other video has ever offered: the exact protocol for doing this correctly after 60. And I want to be very clear about something. Everything I'm sharing with you today is not opinion, not guesswork, and certainly not internet folklore. This is peer-reviewed, published clinical science from some of the most respected institutions in the world: Harvard Medical School, the Journal of the American Medical Association, and long-term epidemiological studies tracking tens of thousands of men across nearly 2 decades. This is the information your doctor should be giving you, and today you are finally going to get it. So first, let's get into the 10 benefits that will completely change how you see your own body. Benefit number 1, it maintains penile tissue health. Think of this as highly targeted physical therapy for one of the most important tissues in your body. Deep inside the penis lies a specialized spongy structure called the corpus cavernosum. This tissue requires regular oxygenated blood flow to stay elastic, healthy, and fully functional. Every erection floods that tissue with fresh blood, stretching the smooth muscle and delivering oxygen to every cell throughout the structure. Without that regular oxygenation, a process called fibrosis begins, where elastic, healthy tissue is gradually replaced by rigid collagen fibers. The result is reduced elasticity, reduced size, and reduced erectile strength over time. Use it or lose it is not just a motivational phrase, gentlemen. For penile tissue, it is a literal biological description of what happens when the machinery goes unused. Regular sexual self-stimulation is one of the most effective ways to keep that machinery in working order. Benefit number 2, it actively protects your prostate. This is the one that changes everything. The Harvard Medical School study I mentioned at the beginning, published in the Journal of the American Medical Association, following over 30,000 male health professionals for 18 years, found that men who ejaculated approximately 21 times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated infrequently. Here's why. Your prostate gland continuously produces secretions between ejaculations. When ejaculation happens regularly, those secretions are flushed out, the glandular ducts are cleared, and inflammatory compounds are expelled before they can concentrate in the prostatic tissue. When ejaculation is infrequent, those secretions stagnate, creating an inflammatory microenvironment associated with increased cellular stress. For men over 60 who are already in the age group with the highest incidence of prostate cancer, this protective effect is one of the most clinically meaningful reasons to take this practice seriously. Benefit number 3, it strengthens your pelvic floor. Every time you reach orgasm, your body produces a series of powerful rhythmic muscle contractions, engaging the pubococcygeus muscle and the surrounding pelvic floor musculature. From a purely mechanical standpoint, those contractions are exercise, targeted, high-intensity exercise for muscles that directly control your bladder function, your bowel control, your erectile rigidity, and your ejaculatory strength. A weak pelvic floor means urinary leakage, softer erections, and reduced ejaculatory force. A strong pelvic floor means the opposite. And here's what most men don't realize. This benefit happens automatically whether you're aware of it or not. If you're already doing deliberate pelvic floor training, this reinforces those efforts. If you're not, you're still receiving some of the benefit every single time. Benefit number 4, it reduces your stress hormones and protects your heart. Orgasm produces a measurable, significant drop in cortisol, your body's primary stress hormone. This happens through 2 simultaneous mechanisms. First, oxytocin surges during orgasm and directly antagonizes the cortisol response. Second, your autonomic nervous system shifts from sympathetic dominance, the fight-or-flight state most of us live in, toward parasympathetic dominance, which is your body's rest and recovery mode. For men over 60 who are managing hypertension, elevated cardiovascular risk, or chronic stress, this is not a minor incidental benefit. Chronically elevated cortisol accelerates atherosclerosis, raises blood pressure, suppresses testosterone, and impairs immune function. Regular orgasmic experience contributes to a lower baseline cardiovascular stress burden over time. That matters enormously for men in this age group. Benefit number 5, it supports your mood at a neurochemical level. Orgasm triggers one of the most powerful natural neurochemical cascades available to the human body. Dopamine, the hormone of motivation, reward, and positive anticipation, surges in the approach to and during orgasm. Oxytocin creates warmth and emotional well-being. Endorphins, your body's natural opioids, reduce pain and anxiety. And serotonin, elevated in the post-orgasmic period, stabilizes mood and produces a profound sense of calm. For men over 60 navigating retirement transitions, the loss of friends or partners, reduced social engagement, or the weight of facing later life, this natural neurochemical support is genuinely clinically significant. It is not a substitute for real human connection, and I want to be very clear about that. But it is a real, consistent, cost-free source of well-being that is available to you regardless of your circumstances. Benefit number 6, it improves your body awareness and could save your life. Men who engage in regular sexual self-care develop an intimate familiarity with their own anatomy, and that familiarity has real clinical consequences. Testicular changes, new lumps, areas of firmness, changes in size or shape are far more likely to be caught early by men who regularly know what their normal feels like. Penile changes matter too. Peyronie's disease, the development of fibrous plaques inside the penile tissue that cause painful curvature during erection, affects up to 10% of men over 50. That number is higher than most men realize. Early detection dramatically improves outcomes, and in many cases, the first person to notice something is off is the man himself, because he was paying attention. Benefit number 7, it is one of the most powerful natural sleep aids available. After orgasm, prolactin surges significantly, cortisol drops, oxytocin rises, your autonomic nervous system relaxes. System settles into deep parasympathetic tone. In chronobiology, the science of the body's internal clock, that is the exact chemical recipe for restorative deep sleep. For men over 60 who face a dramatically elevated prevalence of insomnia, reduced deep sleep stages, and sleep disturbances from BPH-related nocturia, any natural, non-pharmacological mechanism that reliably supports sleep onset and sleep quality is worth taking seriously. This one works, and unlike sleep medications, it comes with an entire cascade of additional health benefits attached. Benefit number 8. It improves circulation throughout your entire pelvic region. The vascular effects of sexual arousal and orgasm extend well beyond the penile tissue. Blood flow increases throughout the broader pelvic region, the bladder, the perineal musculature, the surrounding vasculature. This delivers oxygenation and cellular nourishment to tissue that can otherwise experience stagnation in men over 60. For men managing the lower urinary tract symptoms associated with benign prostatic hyperplasia, this improved pelvic circulation contributes to the health of the surrounding tissue environment, not as a treatment for BPH, but as a genuine complement to overall pelvic health that works quietly in the background. Benefit number 9. It trains ejaculatory control in the safest possible environment. The solo practice environment removes every variable that makes ejaculatory control more challenging: partner presence, performance anxiety, interpersonal pressure. That makes it the optimal setting for practicing the stop-start technique and the squeeze technique, both of which are well-evidenced behavioral interventions for ejaculatory control. For men over 60 who are experiencing reduced control as part of the natural changes in sexual function that come with aging, or who are returning to partnered intimacy after a period of absence, this low-pressure, graduated training environment for rebuilding the neural pathways and voluntary control mechanisms that make partnered intimacy more confident and satisfying. And benefit number 10, it keeps the neural circuits of desire alive. Sexual arousal and response depend on neural circuits that, like all neural circuits, require regular activation to remain efficient. The science of neuroplasticity is unambiguous on this point. Circuits that are regularly activated maintain their connectivity and responsiveness. Circuits that go dormant lose synaptic density over time. For men over 60, allowing all sexual activity to lapse entirely for months or years is not neutral. It is a form of passive disengagement that makes future arousal and response progressively more difficult. Regular self-stimulation keeps those circuits firing. It keeps your brain and body ready for intimacy when it's available. As I tell my patient, your brain needs to practice wanting, just like any other skill worth keeping. Now, as a urologist, I have to give you the complete picture, because this practice, like any medical tool, can help you or harm you, depending entirely on how you use it. Here are the 10 risks you need to understand. Risk number 1, using it to replace human connection. This is the most important risk on this list, and it's not physical, it's relational. Loneliness and social isolation are documented independent risk factors for cardiovascular disease, cognitive decline, depression, and all-cause mortality in older men. When sexual self-care gradually becomes a substitute for the harder work of maintaining genuine human connection, the result is a progressive narrowing of the social and emotional life that is one of the most powerful determinants of how long and how well you live. Use this practice to complement your life, never to replace the warmth of real human connection. Risk number 2, friction damage without lubrication. After 60, the skin throughout your body undergoes documented age-related changes: reduced collagen, thinning of the dermis, slower healing. The skin in the genital region is no exception. Friction without adequate lubrication produces microscopic tears, inflammation, and a real risk of bacterial colonization at compromised skin sites. Gentlemen, for men over 60, using a water-based personal lubricant during any sexual self-stimulation is not optional. It is a basic medical requirement for maintaining skin health in this area. Treat this skin with the same consideration you give to any other part of your body that requires care. Risk number 3, sensory desensitization from repetitive technique. The nervous system habituates to stimulation patterns that never change. When you use the identical grip, the identical pressure, the identical rhythm every single session for years, the neural pathways associated with those specific patterns become progressively more specialized to them. The consequence is that stimulation, which deviates from that established pattern, including the qualitatively different sensations of partnered intimacy, produces less arousal and less reliable response. This is entirely preventable. Deliberately vary your grip pressure, your pace, your position, and your focus across different sessions. This isn't merely a matter of personal preference. It is neural health maintenance. Risk number 4, masking underlying vascular or hormonal dysfunction. If you can reliably achieve erection during solo practice, but you consistently lose your erection with a partner, please do not simply attribute that to age and move on. While performance anxiety is a real and common contributor to this pattern, it can also be masking early endothelial dysfunction, reduced testosterone, cardiovascular disease affecting pelvic blood flow, or early diabetes. The lower arousal threshold of solo practice can allow adequate erectile function even when the underlying vascular reserve is genuinely compromised. If this pattern is consistent, it warrants clinical evaluation, not reassurance. See your urologist. Risk number 5, pudendal nerve compression from poor posture. The pudendal nerve is the primary sensory and motor nerve of the pelvic floor and external genitalia. It is vulnerable to compression when sustained pressure is applied to the perineum, and hunching forward on a hard seat with weight concentrated on the perineal region for extended periods produces precisely that compression. Over time, this causes perineal numbness, reduced genital sensation, and chronic pelvic pain. For men over 60 whose connective tissue and nerve healing capacity are less resilient than in earlier decades, this is not a theoretical risk. The fix is simple: lie down with proper spinal support. Make that your standard posture for this practice. Risk number 6, emotional escapism and psychological dependency. The dopamine reward of sexual self-stimulation is powerful, and for men navigating grief, financial stress, retirement identity loss, or deep loneliness, it can become a primary coping mechanism for emotional pain. When that happens, it is no longer serving your health, it's serving avoidance. The clinical distinction is this: are you engaging in this practice as part of a broadly healthy and engaged life, or has it become your main tool for managing emotional states that would be better addressed through genuine social connection, purposeful activity, or professional support? If you notice frequency increasing during periods of emotional difficulty rather than general well-being, that pattern deserves your honest attention. Risk number 7, the hidden physical cost of shame. Many men over 60 grew up in environments that communicated powerful negative messages about this practice. Those messages, absorbed in childhood and adolescence, do not simply evaporate with time. They persist as a layer of guilt that actively undermines the health benefits of the practice through a pause. Very specific physiological mechanism. Shame elevates cortisol. Chronically elevated cortisol suppresses testosterone, impairs immune function, raises blood pressure, and produces precisely the harmful hormonal environment that this practice is otherwise capable of reducing. The antidote to shame is not willpower, it is accurate clinical information, which is exactly what today's video is giving you. Risk number 8, pelvic congestion from excessive frequency. Just as infrequent ejaculation allows prostatic secretions to stagnate, excessive ejaculation creates a different problem. Multiple sessions daily over extended periods can exceed the tissue's recovery capacity, leading to a persistent sense of heaviness, a dull aching in the prostate region, and sometimes urinary discomfort. For most men over 60, this risk is far less common than insufficient frequency, but it is real and it is worth knowing. Moderation is always the target, not maximum output. Risk number 9, physiological depletion and the need for recovery time. After ejaculation, your body undergoes genuine physiological recovery. Hormones rebalance, neurochemicals are restored. The tissues involved require adequate time before the next cycle begins. And here's what changes with age. That recovery window lengthens significantly. Men over 60 who ejaculate daily may find the cumulative recovery deficit expressing itself as fatigue, reduced mental sharpness, or a general sense of depletion in the days that follow. These symptoms are not weakness, they are reliable biological signals. When you notice them, extend the interval between sessions to 48 to 72 hours and allow your body to guide the frequency rather than imposing an arbitrary schedule. And risk number 10, pornography-driven dopamine dysregulation. When sexual self-stimulation is consistently paired with high-novelty, high-intensity pornographic content, the dopamine system calibrates upward to match that level of stimulation. Over time, the elevated threshold created by repeated pornography use makes the more subtle arousal stimuli of real intimate interaction, a partner's presence, their touch, emotional connection, insufficient to produce the same dopaminergic response. The result is reduced responsiveness to genuine intimacy and a progressive narrowing of the arousal system toward artificial stimulation. For men in or seeking real relationships, this carries serious relational consequences. The recalibration requires practice, specifically practicing self-stimulation increasingly without external visual content, relying instead on imagination and present-moment physical sensation. This is not about moral judgment. It is about protecting your brain chemistry so that real-world intimacy can remain genuinely arousing. Now, here is what I promised you, the section that neither your doctor nor any other video has given you. The exact protocol for men over 60. First, frequency. Research supports a target range of 3 to 4 times per week as a healthy starting point for men in this age group. Not daily, not rarely, regular and moderate. Let your body's signals, energy, recovery, mental clarity, guide you from there. Second, posture. Always lie down with your spine and pelvis properly supported. This is non-negotiable for protecting the pudendal nerve and the surrounding pelvic structures. Third, lubrication. Always use a water-based personal lubricant. Look for products labeled water-based and free of glycerin, parabens, and added fragrance. This is basic skin protection, not optional. Fourth, vary your technique deliberately. Every session, change something. Grip pressure, pace, rhythm, or area of focus. Your nervous system needs novelty to stay broadly responsive. This single habit protects your sensitivity for partnered intimacy. Fifth, limit or eliminate pornography. Replace external visual stimulation with imagination and present-moment physical sensation. Give your dopamine system the space to recalibrate toward real-world arousal thresholds. And sixth, listen to your body's recovery signals. If you experience fatigue, brain fog, or a general sense of depletion following ejaculation, that is your body telling you to extend the interval, 48 to 72 hours. Honor that signal. Treat this as a conscious health practice, approached with intention, moderation, and awareness, not as a guilty secret or a mindless habit. Now, I've given you the protocol, but before you leave this video, there are a few things I need to warn you about, because for some men watching right now, what I'm about to say is more important than everything that came before it. If erections work reliably during solo practice, but consistently fail with a partner, do not assume it is purely psychological. Get evaluated by a urologist. That pattern can indicate treatable vascular or hormonal dysfunction that responds well to early intervention. If you experience pain during erection, notice unusual curvature that wasn't there before, or discover a new lump or area of firmness, stop immediately and see your doctor. These can be early signs of Peyronie's disease or testicular changes that require prompt evaluation. If the frequency of this practice feels compulsive, if it's causing you distress, interfering with your daily life, or something you feel genuinely unable to control, that is beyond the scope of a YouTube video, and I encourage you to seek appropriate professional support without shame. And finally, nothing in today's video replaces PSA screening and regular clinical monitoring. If you are over 60 and not getting annual prostate screenings, please start. So, gentlemen, here is my challenge for you. For the next 30 days, approach this as the health practice it truly is. Follow the protocol. Use lubrication every time. Vary your technique. Respect your recovery signals. Limit the pornography. And notice what changes in your energy, your sleep, your mood, and your confidence. If today's video gave you clarity you've never had before, share this with a man in your life who needs to hear this without shame. Subscribe to this channel for honest, evidence-based men's health conversations every week. I'm Dr. Lila Romano, and I'll see you in the next video.